commotion. One sip and you'll want more. Two and you're on the floor. That devil juice is causing a commotion. Straight on the rocks or in a margarita. Pour me some more por favor, señorita.
Yeah. Yep. Good afternoon. Welcome to the September Chamber Luncheon. I am Shelley Woodward, the 2021 Chair of the Irmo Chamber Board of Directors. I'd like to ask Irmo Town Councilman Bill Danielson to lead us in our invocation, followed by the Pledge of Allegiance.
Thank you, Shelley. Please bow your heads. Dear Lord, today we ask you to forgive us for the things we've done that were wrong and to support us and love us as the frail human beings that we can be. Please support all of our first responders, our medical personnel, and all of our service members abroad and here in this country. Also, please ask our leaders to do the right thing, to make the right decisions, both nationally, statewide, and locally. It's in your name that we pray. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, good afternoon, everyone. It's nice to see everybody here. We have a fantastic crowd today. Before I get into my announcements, I did want to recognize some folks who are here. And I'm going to do this kind of out of order for a reason, but if my wonderful, amazing board of directors will please stand and be recognized, and also my diplomat, who did not have to serve food today. Thank you to all of you for being such a wonderful support for this chamber. I just appreciate y'all so much. Next up, I'm going to recognize some of our elected officials that we have here and other important people. But first off, again, we're doing this a little bit out of order, but of course, Councilman Bill Danielson, thank you for being here and representing Irmo. We have our brand new police chief, Mr. Bobby Dale. Thank you for being here. We also have our brand new town administrator. Where are you, Mr. Courtney Dennis? Back here, you don't recognize him. He's not wearing a uniform. We have Sergeant Hendricks over here. Glad to have you with us as always. And somebody who's very important to me, Mr. Chuck Larson, who was the first president of our chamber. Thank you for being here with us as always. Yeah. But the man of the hour, where is he? Mr. Representative Chip Huggins, who is back here. I have a story to tell you really quickly about Chip. The man can work a phone like nobody's business. So as you noticed, our speaker has changed today, and we found out yesterday afternoon about 1:55 that our Dr. Linda Bell, who was scheduled to speak with us, one of her family members had passed away, and she had to leave town very suddenly. So I called. Didn't know who else to call, so I called Chip. And of course, within an hour, Chip had helped us secure our speaker who will be joining us in just a little while, Dr. Brannon Traxler. She is the Director of Public Health for DHEC. So she'll have some really fantastic stuff to talk to us about. And, she is a medical doctor and, we'll be able to say along the same lines of what we were all here to talk about today anyway. So, Representative Huggins, as always, thank you so much for the work you do for us. I don't know what I would have done without you. Appreciate you. All right, we have a couple of guests. Cindy, can you grab the wireless mic? We have a couple of guests that have not been with us in a while. So if you'll, Charlene, if you want to get up and introduce yourself, Cindy will bring the wireless around. Just say hello to everybody.
Good morning, everybody. It's good to be back again. I'm Charlene Dykes with the Strategic Planning Group, and I'm really excited to be back. Thank you so much.
All right, welcome. Glad to have you here. And Omar, where are you? Omar, we haven't seen you in a while either. Say hello to everybody. Wash down, your bonefish. Yeah, there you go.
Sorry about that. It's been a couple years since I've been here. I'm glad to be back, and hopefully I rejoin soon. Omar Shalaby, financial advisor, certified financial planner, working downtown Columbia.
All right, welcome back. Do we have any other guests who haven't been with us before? Is there anybody else that hasn't been with us? Yes. We need to make an introduction over here with our DoubleTree friends.
Sarah Mallard, our new corporate sales manager, and we're excited to have her. She comes from a great background. Been at catering manager for Ruth Chris downtown for about 5 years, and we're glad for her to be taking over the position as corporate sales manager.
All right, welcome. Look forward to working with you. All right. Thank you, Cindy. I appreciate you. Thanks to OxyTime. They came in before and sanitized the fellowship hall. My friend Raymond up in the crow's nest with Raynet Technology, he's recording this and we'll have it on YouTube for you guys to watch later. Our friend Lee Essig, she's standing right there. Hi, she takes our photographs for us. And of course, Cutthroat Marketing makes all of our digital stuff. I don't even know how to tell you what she does, just everything. So appreciate you guys so much. Brooke, you want to come on up? Everybody looks like they're enjoying their bonefish grill. It's always awesome when they're here with us. So I'm going to let Brooke talk to you.
Thank you. I just wanted to say thank you for having us today. We are grateful to be here, especially through everything that our industry as well as others has gone through over the past year and a half. I want to thank my staff members. I think the chamber's happy that you're here because they didn't have to serve. But I just want to say, thank you for your business. Remember to think about us when you go out to eat. We've expanded our to-go menu through everything. We learned a lot. We've got family bundles. We've added some outside dining to appease to multiple people. So thank you. We're proud to be part of the chamber and hope y'all enjoyed your lunch.
Thanks, Brooke. We always have a really good crowd when you guys cater. It's just delicious. Okay, Raymond, can you put the slide up for Caroline, please? I'm going to go ahead and introduce Caroline. So you guys are familiar with my friend Caroline Ward. She's been around for a long time. She joined the Chamber the year I started, so we've kind of been on this journey together, you and I. But Caroline has been helping folks for a while with their, navigate the Medicare system, which everybody knows is not an easy thing to do. And she started her business last year in the middle of a pandemic like a crazy person. But she has taken her passion for helping others and has developed Ask Caroline Medicare Solutions. So I'm going to let her come up and just tell you a little bit about what she does. Caroline Ward.
So thank you, Carrie, for that introduction. Appreciate it. And as Carrie mentioned, I'm Caroline Ward. I am a Medicare specialist. Most of you already know that Medicare is a health insurance plan for people age 65 and older, also for some other specially qualified individuals. So I want to ask you, you don't have to raise your hand, but how many of you have a mother or grandmother age 65 or over? Nod to, that's nice. How about a father or a grandfather? Aunt or uncle? Okay, you know where I'm going with this. I'm not going to ask you to raise your hand if you are 65 or older. You know who you are, and I'm glad that you're here. So here's my point. We all need health insurance. We've spent the last year fretting about our health, worried about a whole bunch of stuff we had no control over. But what we can control is finding good health insurance that meets our needs. And that's what I do. I help people age 65 and older navigate through the Medicare maze. I admit Medicare is complicated, but it doesn't have to be a nightmare if you let me help. There's no one-size-fits-all Medicare plan, and my job is to help people find the plan that fits their individual needs. I'll be presenting next week at the Chamber's Luncheon Learn at the Chamber House on Thursday, so I'd love for you to come and see me. We will be talking about navigating Medicare. If you have questions, I have the answers. You might want to know what is Medicare, who is eligible. If I'm still working at 65, do I need Medicare? What does it cost? Do I have choices? So join me next Thursday at Luncheon Learn. You can sign up through Carrie or Ginger, probably online. Yep. Sign up. We'll have a lunch there, and I will look forward to sharing with you. Also, one more announcement. If you'll notice on the screen, very important time of year for those of us in the Medicare industry. It's called the annual enrollment or the open enrollment. Once a year, there's a 7-week period of time, October 15th through December 7th, that people who have Medicare or are Medicare eligible can sign up for their plan or make changes. It's a very short window, so if you are 65 and older, you need to have your plan reviewed. The plans are updated every year, so if you're not used to having an annual review, I would love to help you. If you can help me also by taking this card, it's front and back, and if you know someone 65 and older or someone interested in Medicare, or if it's you, just take a look at that card, pass it out for me, and I would like to ask you to let me be your Medicare lady. So thank you so much for your time and your support, and back to Carrie.
Well done, friend. Did a great job on that. Thank you so much. We appreciate you sponsoring this. I know that your life is about to get really crazy because I think most of you who sell Medicare make your entire living in that 7 weeks, don't you? Yeah. All right. I have a couple of announcements that I wanted to make you guys aware of. Who in here is a graduate of Leadership Lexington County? Okay, we got quite a few. So I serve on the board for Leadership Lexington County, and for those of you who are not aware, it's just like Leadership Columbia. It is it's a class that you go through over a year, and you do, we call them adult field trips for half the year, and then you work on a service project for the other half. But it's probably one of the greatest things I've ever done in my entire career. We opened up applications today for the class of 2022. So if you are interested in applying to be in that class, you do have to fill out an application, and you do have to go through a little bit of an interview and all that kind of stuff, and of course, pay the tuition. But we do have a link on our website under resources where you can go and send an email to request an application, or you can just come to me and I'll be happy to help you with that. It is an incredibly rewarding experience. I think everybody in here who is a graduate will tell you that. I really feel sorry for the class of 2021 because they've had a heck of a year not being able to have the actual experience of it, but it was really cool. I got to tour the dam. You go out to Raw Farm and see where they, make all of the collard greens or grow all of the collard greens and then process them. Well, they process them. Don't laugh at me. they process them, and they all wear the hair nets and stuff, you know? Anyway, there was a lot of really cool stuff that we did. So if you're interested in that, please see me. It's an amazing network of people to be involved with. Also, you'll see on your tables, Representative Huggins and Representative Ballantyne will be hosting the 16th annual Irmo Prayer Breakfast next Thursday at East Lake Community Church. That's the big church across from Castle Brothers, I believe, right? So plenty of room in there, and if you guys haven't ever been to that, it is a fantastic event. And this year we have Dr. Christina Melton as our keynote speaker, which, you know, is amazing. So I hope that everybody will, will come to that. Chick-fil-A in Ballantyne serves our breakfast, and tickets are available. So you can also always call us at the chamber if you want more information about that as well. And I think it's on Facebook too, isn't it? Okay. It's a free event. Okay. Yeah, it's an incredible way to start a Thursday, you guys. So if you can make it, please do. Ginger told me that we have 3 teams left for the golf tournament. So if you plan to play in our golf tournament on September 30th, you should. It is a lot of fun at Mid-Carolina Club, but we have 3 teams left. We have plenty of holes to sponsor, and we have plenty of places for them to set up on holes as well, right? So if you guys are interested in that, come out and have a good time with us. September 30th at Mid-Carolina Club, 1:30 shotgun start. Okay, my friend Mark is here. He drove all the way here from Charleston. I have to tell you, we work with Mark every year. This right here.
Now I don't have to hold it.
Yeah, so we work with Mark every year for this, and this is something I'm really proud of. This is our visitor's guide that we give out at the Irmo Chamber House, and we've already taken the photograph for the front page, and that's going to be super exciting. Lee did that for us, and I cannot wait to roll that out. But you want to talk to them a little bit about deadlines and how to get in this guide.
Right.
Yeah.
Thanks, Carrie. I thought you were just going to continue on, so I was just going to stand here. So, anything else? We good? All right. What she said, and we're just starting the sales on this publication for advertising, and it'll publish at the end of the year. So, there's more books over on right there. And and I'm sitting over here, I'll be hanging out after we're done. So you want to come say hello and talk about some advertising. It's all good. Thanks.
All right. Thanks, Mark. We give a lot of these out, so this is a good place to put your message. If you like print advertising, this is a good way to get your message out. We also offer this online as well, so the whole publication is available to anybody online. And this year we did all of our accommodations. We spent all of our accommodations tax dollars digitally this year to. And Cindy helped me increase our resources section. So we got a ton of hits on this thing this year. So anyway, buy an ad. Okay. We have one of our new partners here today, Miss Naomi. You want to come up here real quick and say hello to everybody? She doesn't really want to, but you can do it. Come on up. Introduce yourself.
Hi, my name is Naomi Garnett. I am a financial representative with Martin Woodman of America. I have been with Martin Woodman for about 1.5 years. I'm also a pharmacist. I am a retail pharmacist. I've been a retail pharmacist in the Columbia area for 34.5 years. And I am looking forward to working with the chamber. I help my clients with life insurance, retirement planning, and other financial services. And we support our members and our communities, such as with the member services, service projects, educational programs, and also matching fund programs. So I'm looking forward to working with the chamber. I'm glad to be a part of the chamber.
Thank you, Naomi. Naomi came and sat through my Partner 101 last week, so she's been chambered to death for the last couple of weeks. All right. You ready? Okay, wonderful. So I want to make sure that we give our speakers as much time as possible because I know there's going to be a lot of questions. So I I'm going to do the introduction because you guys need to hear how qualified she is to talk to you about all of this. But we have Dr. Mrna Traxler here. She currently serves as Director of Public Health for the Department of Health and Environmental Control, DHEC. In this capacity, she provides strategic direction for public health, leading more than 1,900 public health employees. She ensures the delivery of appropriate, timely, and quality services at DHEC's 74 public health service sites. You are a busy woman. Located in every county of the state, and the performance of the Central Office Bureaus of Community Health Services, Communicable Disease Prevention and Control, Maternal and Child Health, Health Improvement and Equity, Chronic Disease Injury Prevention, Public Health Laboratory, Public Health Preparedness, and Community Nutrition Services. She doesn't ever sleep, ever. She just works all the time. She's a native of Greenville. She graduated from Clemson with a degree in microbiology. I'm a Georgia fan. I just got to slide that whenever I can. Come on now. She earned her medical degree from the University of South Carolina School of Medicine. So she got the whole state covered. And she has a Master of Public Health from George Washington University. So please give her a warm welcome. She is doing me such a favor to be here, Dr. Mrna Traxler.
Thank you. You have to have a lot of bureaus and a lot of service sites when you have, I think it's over 2,000. I think it's over, maybe over 2,200 public health employees now with the pandemic. So, but they are phenomenal. I cannot tell you enough good things about my team. They blow me away. But thank you for that introduction. My blood still does run orange. Sorry. But and I sleep a few hours each night. 3 or 4, depending on what's going on with the pandemic. And thank you all for having me. Dr. Linda Bell was supposed to be with you all, and I send her apologies. She had a death in the family, and so I'm subbing in for her. I know I'm no Linda Bell. She's phenomenal, so I apologize, but I will try to do the best I can. And decided to give you guys an update on kind of where we stand with COVID-19 right now, because I know that is the most popular, or at least most talked about, public health topic. A lot of folks, I don't think, knew public health really was a thing, even until this pandemic. But by golly, everybody's aware of it now, a year and a half in. So, and then I'm going to leave time for questions. Yep. Oh. Yep. I got it. That's the Carolina degree that taught me how to do it. Okay. It's on. Next slide. Oh, wait, hold on now. Let me get this done. Look. This is what all those degrees will do.
Okay, now it's on. There we go.
What'd you?
I forgot to give him this. It's my fault. It's my fault.
I didn't say that. I'm sorry, what'd you say? Y'all are more than neon orange. I have to be careful when I'm getting my orange clothes. You know, you have to get the right shade. All right, we're up now. So this is what we call an epi curve. If you guys remember way back 18 months ago, there was a lot of talk of flattening the curve, and that was kind of the thing that everybody wanted to do. This is the curve that everybody was talking about then, the epi curve. And so this is looking literally day by day, graphing out as bar graphs, how many cases there were reported in the state. And then the green line is that moving average, moving 7-day average. So you can see kind of our 3.5 maybe surges we've had. It's kind of hard to call this little blip right here a surge when you see what was coming, but I can tell you at the time it very much felt like a surge back in that original spring. We then had the increase last summer that we saw. It peaked again, I think, around late July, maybe the third week of July. Cases got better. Oop. I wasn't done. Did I do that? No. I'm trying to go back. There we go. Okay. And then you can see where we really have seen our worst, which was during the winter. I think it was that second week of January, early in that second week of January. And then got really good down here in the early part of the summer. Everybody was feeling really good. And then you can see where we are right now. It's a little hard to tell. The increase might be slowing a little bit, but it really is too early to know for sure. And you can see what a sharp increase it's been, but I try to remain optimistic. So we are in our 12th week of increasing weekly cases. We've had 11 consecutive weeks, but every week I hope that we're going to turn the tide. We're going to start flattening that curve and plateau out and come back down. In the state, we have now had 773,185 cases, and this is as of yesterday afternoon. Like I said, that's 11 weeks here recently of increasing case counts, where things had looked so good earlier, in the summer. Yesterday, we reported for one day 3,757 cases. Unfortunately, we're coming up on 11,000 deaths from COVID-19 in the state, and these are people who COVID-19 and the person's profession, and either the physician or the coroner's professional judgment contributed to their cause of death. So you might hear, my favorite is the story of the person who gets hit by a car and then somehow is found to have COVID, and they mark him as a COVID death when really he died by getting hit by the car. That would actually be fraud, insurance fraud probably, or something Medicare fraud, because you would know better than me for that. But when you are certifying a death, you have to put down what the cause is. So that's almost 11,000 people in our state who COVID-19 has contributed or directly caused their death. 28 of those were reported yesterday. I will say that we saw a little bit of a delay in the increase, this most recent surge in the deaths increasing. We always expect to see it happen a couple weeks after the cases start increasing, but we really had several weeks where we were not seeing deaths increase, and really we're hopeful, but unfortunately the deaths have started increasing. You can see, you may remember also way back when, 18 months ago, tests were nearly impossible to get. I remember the days of having to, at 2 in the morning, get a phone call from somebody in the ER with a potential patient and actually call the CDC. And I would have to talk to my counterpart there and get their permission and actually send a specimen to Atlanta to be tested. That's how we started out. Now we're at almost 10 million tests performed for South Carolinians. We have seen recent increases in testing as we've seen the increases in cases, and that's good. I want to encourage everyone to, if you feel you've been exposed or know you've been exposed, if you have symptoms, please go and get tested. It's free. There's access throughout the state. The turnaround times have not started increasing. I've heard anecdotally of every now and then different places having a little bit longer wait times to get tested, but the results are still coming in, in that 24 to 48 hour time frame. Okay. This is looking by week at by age group. And this actually only goes till about the third week in August, because that's how far we had the confirmed data, and our data team put this together for me a few days ago. You can see the orange line, the non-Tennessee, this is the Clemson orange line, are the young adults. And that is the category where we're seeing the highest rate of cases, and they're still leading. You can see then that the gray is middle-aged and the yellow is the elderly. We're seeing fewer elderly case rates, probably because they're the highest vaccinated group we're seeing in the state. But those two curves are running parallel pretty much, or those three in parallel to each other. The blue is pediatric, so it's under the age of 18. And you can see that that curve has started changing. It's not following the others, and it's increasing. I'm very interested within the next week or so when they redo this for me with newer data to see. I hope that we do not see further increase, but certainly at this time, not all of schools starting was reflected. But the young adults are still the ones who are the majority of our cases, and they're eligible for vaccination. So young adults out there, please get vaccinated. If you have a young adult that family member, encourage them. I keep wanting to point at the screen. There we go. Looking at other data, we're up to 57.7% of eligible people, so that's over 12 years old in the state, who are vaccinated, who have gotten at least one dose. And of those, almost 50% have completed their series, so 48.7%. You might be aware there's 3 vaccines that are authorized for use for COVID-19. 2 of them, the Pfizer and Mrna, each require 2 shots. The Janssen or Johnson & Johnson, that's the same thing. It's just a matter of one's a sub-company of the other. It's just a 1 shot. But so to be fully vaccinated, you have to have completed your series. Hospitalization data, looking at this is as of yesterday, unfortunately, almost 2,500 people in the state were hospitalized for COVID-19. Of those, 568 were in the intensive care units, and 403 of them were on ventilators. And that does include, I have not seen the latest data from over the weekend, but it had been including anywhere from, around 5 or 8 children in the state who are on ventilators. And some of those were old enough where they could have been vaccinated and weren't, and some of them were too young to have been vaccinated. Looking at the data for our sequencing, for the variant, as you might have heard, the Delta variant is what we're seeing right now. It's the one that's so contagious and spreads so much more easily. We are now at 99% of the sequences, so basically 99% of cases in our state are the Delta variant. And that's pretty common with what's being seen nationally. There are some new variants that are out there that you might read about, Lambda and Mu. They give them all Greek letters. I'm going to have to learn the Greek alphabet. But those, there is some early information that suggests maybe, they might even be riskier. It really is just too early to know. The CDC is certainly monitoring on the World Health Organization. We're monitoring what information they put out. At this time, neither of them are labeled a variant of concern by the CDC, meaning they don't have proof necessarily that it's one that we need to particularly worry about, that it's going to be worse than any others. But it may just be too early. We'll have to keep an eye on them. So this is looking at vaccinations, and this is the same color scheme. So the young adults, nope, sorry, that's right. They changed the color scheme. I asked them for the next round to please make it the same for people like me. You can see, though, that the elderly, who are this blue, were that first group, and they really turned out really well to get vaccinated. They're the ones who were the highest hit age group early on, and they were the first really general age group to qualify for vaccination. So you see the spike where they got vaccinated. That was followed then by the middle-age spike. Unfortunately, the young adults, which are the yellow, and then pediatric, which is the gray, which of course only 12 to 17-year-olds of the pediatrics are eligible. So that's kind of a little bit of a difference there. But what the really thing that stands out to me here is that young adult curve. We're not seeing that spike. We're not seeing that big surge in them going to get vaccinated. And so that's probably partially why they are that orange line that's leading on the other one. So I wanted to talk to you a bit about Delta to understand why it matters, why anybody cares about the fact that Delta is out there and is the predominant strain as opposed to, say, Alpha. The original COVID strain, the original virus that we saw, would infect on average, you'd say about 2 people. I think it was a little bit less, but it's hard to depict a partial person on here. You can see each of those 2 people then infects 2 more. Each of those infects 2 more. You can see how it can spread if you don't, do isolation and quarantine to slow it. So you end up then 4 generations out with about 16 people that are just in that 4th generation, having come from that original one. Delta is about 2.5 times more contagious than the original. And that doesn't sound, at least to me, it doesn't sound that bad, 2.5 times more contagious. I mean, that's a small number. Until you look at it and you see how that can quickly multiply. So looking at our original scenario, that means that 1 person can infect 7, and so forth and so on. And you see then that by the 4th generation, you've got these multiples of, 343 people, each that end up in that 4th generation. So that shows you how something being just 2.5 times more contagious can spread so much more easily. So kind of where are we going from here? I really wish I had a crystal ball. If I did, I would have, certainly known what was coming and would have ended the pandemic somehow by now. But really, this is a new virus. This is a new disease. We have new versions of the virus even every so often, such as Delta. We're still having to base, our guidance on data that's still emerging. It's difficult then to do projections. Certainly there are plenty of very smart groups and folks out there that are doing it with kind of mixed results. It's really hard to say for certain when we're going to peak, for example, right now with this surge. Like I said, I get hopeful. I'm optimistic every week until I get the numbers, but I still remain optimistic week to week. We don't know how future new variants are going to play into that. It could be a long time or never before we get one that's even more problematic. Certainly the concern would be if we got one where it could evade the vaccine and the vaccine wasn't as effective against it. The vaccine right now is the vaccines that are available are very, very protective. They're very, very safe. They're very, very protective against severe disease. And you have to understand that's what they were designed. They were designed to prevent death. When you're in a pandemic, that is the number one objective, is to prevent death. So the fact that there are breakthrough cases, certainly we wish there weren't any. We wish there were no cases in general. But it's not, completely surprising because we know that the vaccines aren't 100% effective at just preventing infection. But they are extremely protective against hospitalization or death. The last thing I want to say before I take your questions on COVID or any other public health topics is that the vaccines and masks are very safe. They're very effective. I have been vaccinated. My family all has. I have a baby. I cannot wait for the day that the FDA gives an emergency use authorization for her age group because I will be the first one in line wanting to get her vaccinated. So I'm practicing what I preach. I promise you that I'm not telling you something that I wouldn't do or even have my own child do. If you want a place to get vaccinated, you can go to vaxlocator.scdhec.gov, and it'll give you locations you can filter by, anything you want to filter by pretty much. So, any questions? Thank you.
Can you talk a little bit about the vaccines and which vaccines are best for which age group? For example, which ones you're recommending for the youth, for the seniors, because we've got 3 of them.
Sure. So for anybody 18 years or older, the message really, and it really is true, the easiest one for you to get is the best one for you. All 3 are safe and effective. I took the first one that was available to me. I have family members who have received all 3. So whatever is the easiest for you to get is the best. The Pfizer one is the only one that is authorized right now for under the age of 18, and it goes down to age 12 currently. Rumor is they're going to apply for authorization for the next age group down, so like 5 or 6-year-olds through 11-year-olds later this fall, but I don't have any inside knowledge to share, about that. But the Pfizer would be the one for teenagers. Otherwise, it really is the best one that's available to you, the easiest one to get to. Tennessee.
Yeah, can you talk about the booster shot?
Sure. So, yeah, booster, third dose, whatever the word is these days. So right now, it is only recommended for one group of people, and that's people who are immunocompromised, meaning their immune systems don't work as well. And that, it's really indicated for it to be a third dose. These are people where their body might not have built the antibodies that they should have built with the first 2 doses. And so they have proof that by giving another dose to those people, it'll get them up to basically where the general public who got vaccinated were in terms of protection. The boosters, we are still waiting to see the data. The FDA is poring over it as we talk for Pfizer and then for Mrna to determine when the optimal timing is going to be to get a booster for those 2 vaccines. For the Mrna, whether it will be indicated at a half dose or a full dose. There was some of their data that suggested that it might need to just be a half dose for that 3rd shot. And they're still collecting data for the Johnson & Johnson vaccine to determine those people will likely need a booster at some point, but the data collection's not finished there yet to know when.
That's not the word that's out. I was literally asked if I wanted to get a shot at CVS 3 weeks ago and got the thing. I said, I've already had 2. He said, you're in the room. I felt like I was solicited to get it.
And
did I make a mistake?
no, it's not going to hurt you. You might not have needed it yet, but it's not going to hurt you. We have communicated to all of our providers, certainly the information that we have received from the federal government. We are actually in the process of working on more messaging to send out today or tomorrow to all vaccine providers, reminding them that right now the only folks who should be getting them are people who for their immune system is not, completely functional at the same level as everyone else. And just to let you know, all you have to do if you do have a lower immune system is self-attest. So you don't need a doctor's note or anything like that. So people who are on chemotherapy, have had some kind of transplant, take one of certain medicines that lower your immune system. All those folks are eligible. If you have some certain kind of more rare conditions that affect your immune system, all those folks are eligible, and all you have to do is say, yes, I'm immunocompromised. You don't need any kind of special note or, order or anything for it. But that is, you're not the first person I've heard that from, and that's why we're working on even more messaging to remind providers of that. We just want to make sure everybody gets it at the best time for them. We don't want anybody getting more shots, in a lifetime than they need. I don't know anybody that wants that. But we want to get it to folks who need it when they need it. So we're working to continue sharing that message. We have over 1,000 vaccine providers in our state now, though. So it can be hard to make certain that everyone is doing what they're supposed to be doing, but we're doing what we can for that.
I have a question. I know I'm walking around with the microphone, so I'll just hijack it. But speaking of the vaccine, I've had a lot of people talk to me about the fact that we didn't have enough time to develop this vaccine and that we don't know enough about an RNA-based vaccine. Can you actually explain a little bit more about what this vaccine does and how it's different and how it is going to affect us if it changes our DNA or anything like that?
Certainly. It does not change your DNA, okay? I promise. I also promise that there's not a microchip in any of the vaccines. No offense to anyone, but I'm not interested in tracking you, okay? So, and I don't know anybody that is. Certainly, so the mRNA vaccines have actually been in development for almost 20 years, which a lot of folks don't realize. But they started being developed when the first SARS epidemic occurred back in the early 2000s. And so they just continued that work, and they were able to pick up really where it had just kind of stalled out as soon as they knew what virus we were dealing with here. And so that was why they were able to develop it so quickly. No corners were cut, or steps were skipped. They had all these years of work behind the scenes that had been done, and so then they could ramp it up here at the end. The mRNA vaccines put a little piece of the mRNA, so they don't put the whole virus mRNA in. They put a piece of it in that codes for that spike protein you might have heard about, which sounds, I think, a lot more glamorous than what it really is, but that seems to be essential to how the virus gets into your cells. So it makes just that piece of just that spike protein. By itself, that spike protein can't do anything to you. It doesn't have all the rest of basically the body of the virus that causes damage. So then you have some of those spike proteins in you then from that mRNA, and it causes your body to make antibodies to it. And antibodies are the good thing. That's what protect us against all sorts of different things. So then you have those antibodies, and that's what we're looking with the booster to make sure that you keep a high enough level of antibodies so that if you get exposed to the virus, those antibodies can jump on it and get rid of it before it can do any damage. The vaccine itself and the components of the vaccine are out of your system in a matter of days. So I know that's one of the concerns a lot of people have is what about the vaccines causing long-term problems? But the actual components that go into your arm of the vaccine are filtered out through your liver and kidneys within a matter of days. And so all that's left are a few proteins that can't do any harm that your body's then making antibodies to. And it gets rid of then those few proteins even. So there's nothing left in you unnatural, so to say, beyond those few days. Nothing external to your body that's come in persists after a few days. Yes.
Thank you, Doctor, for being here. We appreciate that, especially short notice. But I'm totally confused.
Sorry.
And those who know me know I'm always confused.
It could easily be my explanation too, though. So.
I have a question and a quick follow-up. We throw this term around
immunocompromised.
Immune compromised, okay? How the heck do I know if I'm immune compromised? Brief story, 11 months ago I finished my chemo and radiation treatments. I'm perfectly healthy.
Congratulations.
My scans are great, thank you. I'm not bragging. I'm just saying I'm confused.
Right.
I feel great. I'm pretty much over it. I got a team of doctors behind me. It's like a platoon, right? Wherever I go, they follow behind me. None of them have called me and said, get your butt in for a booster, okay?
Right.
So I don't know if I'm immune compromised, first thing we throw around. And the second thing is if it's a half dose or a full dose for a booster, why bother? Just give them the full dose. I don't get it. If it doesn't hurt you, what's the point? Why are we further confusing people?
Sure. Two great questions, and so but separate. Sure. So, I could tell you weren't really confused. You knew what you were talking about enough to ask the question. So if you're immunocompromised, there's information on our website as well as the CDC site. Like I said, it's mainly several different groups. If you're still currently undergoing chemo or have very recently, like within the last month or two, finished it, and if you have any question about the timing, of that, really any questions, I'd recommend reach out to your doctor. The second one being if you've had a transplant, either bone marrow or an organ transplant where you're taking medications that lower your immune system for the rest of your life, then you are. If you have, like I said, one of a couple of rare, usually inherited disorders that you would very much know about and you would know you are immunocompromised. If you have untreated HIV, or the last one being if you take one of certain groups of medications, with chemo is an example of that. Others are the biologic medications for like sometimes inflammatory bowel syndrome or whatnot, like Humira, things like that. They lower your immune system, not to the extent that chemo does, but they still lower it some. So if you have any question, especially about the medications, but about any of it as to whether you qualify or not, reach out to your doctor. If you've got a platoon of them, pick the lead one. pick the leader of them, or just your general practitioner. That's who, honestly, usually has a finger on the pulse of your health the best to know. And you certainly could always ask, if your pharmacist too. They might not be as quick to be able to answer as your doctor, but if they know that you're on one of the medications, for example, they might be able to tell you. And as to your second question, well, the reason we don't want to give people a full dose if they don't need it is because what if the full dose does cause a little bit more side effects? Side effects being that like 24 hours of feeling crummy. We don't want to make everybody do that if nobody has to do it because they only need a half dose, for example. So that's why it's not going to hurt them long term, but it might have a little bit higher risk of feeling crummy for that first 24 hours or so. So you don't want to have to feel crummy unnecessarily, potentially. Certainly.
Okay. This time of the year, I'm typically planning an annual activity called getting my flu shot.
Yes.
Okay?
Yes.
Now, I'm fully vaccinated.
Yes.
And tell me how this plays one way or the other, okay?
Get your flu shot.
Get
Great
your flu
question.
shot. Okay.
Get your flu shot. You can even do it the same day as your booster. And that is different. Well, at least you get it out of the way at once. I will say, unfortunately, they have to be separate arms, so you still have to have separate arms, but that is something that they have learned. Originally, you couldn't. So I needed to get a pertussis, a whooping cough booster, before my daughter was born, because real babies are really prone to that. And they told me, oh, you can't get it at the same time as your COVID. It has to be at least 2 weeks apart. And so I was trying to time all that. And spoiler alert, I didn't get the pertussis booster till she was like a month old, but thankfully she did okay. That was just the soonest it would work out. Now they have data to show that it's safe to get other vaccines at the same time you get the COVID ones. So get a flu shot. Our hospitals, as you saw by those numbers, are very, very full right now. They are stretched to the limit. We know that people get hospitalized every year with complications of the flu. We really need to keep those numbers down this year because our hospitals can't handle that strain of both of them at once. So please get your flu shot. CDC is saying get it before the end of October this year. I'm scheduled to get mine in a week and a half. And then if you want to time it at the same time, hopefully for boosters, which will hopefully, at least for Pfizer, start being available in a couple weeks, then you can do that simultaneously.
So I'm fully vaccinated. I had COVID in November, and I was told and read somewhere that you're supposed to wait like 8 months after your last vaccination to get the booster, but because I had COVID, should I wait longer than that?
No. And so you had COVID anyway before you got your first two?
Yes.
Okay. No, you don't have to. Even if you had a breakthrough case and had COVID since you had gotten that original series, there's no information, no data right now that suggests you need to wait longer, for example, than others. Those specific details are information that'll come to us, that we'll share, that'll come from the CDC's Advisory Committee on Immunization Practices once the FDA gives an authorization for the boosters. So all those kind of details will be coming out, but I have not heard any information, or I have not heard of any data to say that you need to wait longer than everybody else. If anything, what I've heard in the data is that unfortunately you had to go through COVID. Fortunately, you might even have a stronger protection now from having that and the vaccinations.
Hi, I've got a question. Will you have to get a new immunization every time there's a new variant?
That's a great question. And so it depends on the variant. We hope not. If we can get these numbers, if we can get the spread of this virus calmed down enough where it can't spread so much and mutate so easily, then the odds are better against that. So this booster that they are going to probably authorize, we're assuming they will, is not going to be anything different other than maybe a smaller dose, but it's not going to be a different formulation than what you've already received, because what we've already received is still very effective against the variants that are out there, even Delta. If the virus continues to mutate more and more and we get more dangerous variants, then it may be to that point. But that's why we're kind of in a foot race right now with vaccinations against the mutations of the virus. We need to get ahead in the vaccinations so that it can't mutate as quickly, or at all, ideally.
So my question is, what do you tell people who are absolutely defiant about getting the vaccine?
First of all, I wouldn't say they're defiant. I would say that they just are convinced that they don't need it or shouldn't get it. I don't know that I would call that defiant. Because everybody does have to make the right decision for themselves. My goal is to make sure that everybody has the facts and that accurate information so that they can make the decision that's best for them based off of the truth. And so helping to share that factual information from sources that are completely neutral, don't have any hidden agenda. I promise DHEC doesn't have a hidden agenda. We vocalize that we want people vaccinated because we want this pandemic to end. Trust me, we all very much want it to end, just like you do. Sharing that information, sharing your story even. If it's somebody you know well, explain how you came to the decision to get vaccinated, what your vaccine experience was like. People really do look to others that they trust for the sources of information.
I have two questions. One, is it beneficial to get an antibody test to find out how much you have left, from the vaccine? And two, if a child is under 12 and tests positive for COVID, does he have to stay, is it the quarantine time from the time he gets a positive test, or is it from the time he was exposed, and how long is that? I've heard 10 days, 14 days, all kinds of stuff.
Both of those are great questions. You don't need an antibody test. In fact, unless you just like being stuck with needles and having your blood drawn, you really don't need to. I haven't been antibody tested at any point during this. And I'll tell you why. The tests that are out there right now for antibodies are kind of a yes-no. You either have them or you don't. But that's great. It doesn't tell you if they're the neutralizing, which are the type that are actually protective. And it doesn't tell you how many you have. Tests are starting to emerge for antibodies that tell you your titer, which is basically your level of antibodies. Again, though, it doesn't tell you whether they're the neutralizing type that are protective or if not. And second, we don't know what level of antibodies you would need in your system to be protective. That's data that's still being collected. So it could come back and tell you that you have 1 million antibodies, but what if you need 2 million to really be protected? So that's why you don't want to get a kind of a false sense of security based on the antibody test. So if you're curious, or if you like being stuck by needles, go ahead. But please don't get that false sense of security from it. As to the second question, so regardless of the age of someone, if they test positive, they need to isolate for 10 days, okay? And that 10 days starts from when they developed symptoms. So let's say that today's Wednesday, let's say if I develop a cough tonight, and I go tomorrow and get tested and I get my results back Saturday. Day one, though, was today, because that's when my symptoms started. So it's 10 days from today. So that would be next Saturday, I guess I'd be finished. As long as I didn't have a fever for the last 24 hours of that and my symptoms were improving. It's 10 days. That's exactly where I was going next. If nobody ever develops symptoms, let's say they get tested because they were exposed, then the 10 days starts for when they put the swab in your nose, when they collected the test. Not when you get the results back, but when they actually perform the test on you. So, and you were asking, you mentioned some other numbers of days you're throwing around. Those are for quarantine for people who are exposed, who are not fully vaccinated. And I won't get into that because there's some different options for shortening, et cetera. But that can be anywhere from 7 to 14 days, depending on the protocol and such used. So, yeah.
Two questions for you. One, CVS, Walmart are all using self-home tests now.
I'm sorry, what test?
That you can buy at-home test.
Oh, self-testing at home. Mm-hmm.
How accurate are those? And then lastly, with the numbers you posted earlier on recent deaths, what's the percentage, do we know the percentages of those people who are passing that weren't vaccinated versus vaccinated?
Yes. So let me give you the second one because it's the easier answer first. When we have looked at our data from what the information we have, it's been in the high 70% for July and August of people who have died of COVID-19 who were not fully vaccinated. I can tell you, if you go, a lot of the bigger hospital systems are putting this information out in kind of dashboards. They're doing great, like stick figures. It's really interesting to see on their websites. They sometimes will have even more updated data than we will. As you can imagine, if somebody passes away, when we go to call them to do that case investigation, we can't call that person. We're very sensitive of the fact that their family is grieving, so we certainly try to politely and respectfully do a contact, a case investigation and find their contacts, but we're not going to push too hard. So the hospitals will often know vaccination status that we might not know. A lot of them are reporting up in the 80s, even low 90% per hospital, out of the folks at least that are passing away in the hospital that are not fully vaccinated. As for the self-tests at home, they're certainly better than nothing. I will tell you that they are more accurate when used if you have symptoms than if you are just screening or just exposed and feel fine. Really, the gold standard is still that PCR, which is that test that goes to a lab and takes anywhere from 24 to 48 hours. That's really the gold standard. The rapid antigen tests that you do at a doctor's office or a pharmacy, where the pharmacist and so forth is doing it, are kind of the next best. And those, again, though, are more accurate if you have symptoms. And then the self-tests, follow the directions. That's my biggest advice for those is, if it's better than no test, but ideally try to get one of the others. If you do use it, it's better if you have symptoms, it's more accurate, and certainly follow the directions very closely. Because they can be very nuanced, like put 6 drops in the second hole, twist the swab 3 times counterclockwise. Just follow the directions very carefully. Even I do when I am doing rapid antigen tests on somebody. I still follow the directions.
Okay, what is really the contributing factor to a lot of people dying? That's one part. And the other part, and I'm at a lot of meetings just like this right here. Should we be wearing a mask?
So the first question you asked, what is the contributing factor?
For most people's deaths.
Sure. So, and I don't have the most up-to-date off the top of my head for the percentage of people who have died who have underlying health problems, but certainly it is the majority. I will say that with Delta now, we are seeing somewhat younger, somewhat healthier folks, just unfortunately. But we do know that the majority of folks do have some underlying condition. That ranges, though, from everything from high blood pressure that's very well controlled on 2 medicines to somebody who's got stage 4 cancer. It really is kind of the whole spectrum. In general, the better health you are, the better chances you're going to have a good outcome, even if you get infected. And your second question, everybody has to assess their own risk level. But remember that the masks mainly work to protect other people. They do help protect you some, but they mainly do it for each other. So it really is most beneficial when everyone's doing it. I can tell you, I have a 7-month-old at home who's not eligible for vaccination. I can't put a mask on her because she's teething, first of all, and she'd eat it because everything goes in her mouth and gets chewed on. But plus she's under 2, and that's really the age at which the CDC says it's okay to start putting a mask on kids. I am very, very careful. I'm fully vaccinated and everything, but I still, unless I'm kind of this distance away from folks, I'm wearing one, if I'm not eating or drinking. And I'm doing it not just for myself and my daughter, though, but I'm doing it for everybody else on the chances, what if I was an asymptomatic positive? And this is a little bit different setting because you're eating and drinking. But so in general, I tell folks, wear it then when you're not eating and drinking is really the best. If you can't distance and do things like that. Certainly outdoors is safer than indoors. Increased ventilation. I've learned a lot about air conditioning systems. I've learned a lot about ventilation on school buses. The airflow patterns. There's a lot of things in this pandemic I've learned a lot about that I never would have thought. But all of it adds up together to be protective.
Dr. Traxler, we're at our time. are you able to stay for a few minutes to
I am.
take questions?
I
Okay,
am.
so she's going to stick around. Thank you so much for
welcome.
agreeing to do this for us. I'll stand over here, but I got some door prizes.
Go for it. I turned your clicker off since I now know how to
Thank
operate
you.
it.
I just learned that it doesn't work with our current technology, so he has to advance your slides anyway. So I just learned that today. It wasn't you.
Let the
yeah.
record show it was not me.
Okay, get your tickets out, please, everyone. We've got quite a few things up here. Chef Judy over here, she is doing a snack box for Art of Charcuterie, and that's going to go to 669. 669? Anyone? Is that you? Oh, cool. Okay, got it right here. Okay, Judy brought us some pint glasses from Experience Columbia. There's 2 pint glasses here, and they're very cool. They have the Gervais Street Bridge on them and nice little collector's items here. That's going to go to, oh, that's the wrong one. That's going to go to 629. 629? Anybody? Bueller? Okay, next up, 649. 649? Did all these people leave? Like, I didn't see anybody leave? Okay, 588. Seriously, y'all? No, that's not what I drew. Okay. All right, 655. Okay, come and get your pint glasses right here. Okay, our friends over here at Bird Dog, they, if you have not been back there to see them and you're between the ages of 50 and 70, go get your $10. They've given us a $10 bill, and that's going to go to, I'm giving away money up here, it's raining. 625. 625, Matt. Dr. Matt. All right, I got another $10 bill, and that is 626. 626, John Manjonas? No? 626? All right. What? You can come up and get it. All right, I've got an Irmo-opoly game. All right. This is for the Irmo-opoly game. 641. 641, yeah, Ruby. All right, I want to see you and Jason play in that. I want to see some social media. Thank you, dear. Okay, 665, and this is for carpet cleaner from Karen at Carolina Carpet Cleaning. All right, come on down, Bruce. Wonderful. Okay, I have our friends over at the DoubleTree, a complimentary suite and breakfast for 2 at the DoubleTree. Absolutely. And that's going to go to 607. 607? Anyone? Oh, look at that. Celebration. Yep, get a babysitter. Yep. All right. Next up, we have got some tickets to tonight's pancake supper at Union United Methodist Church. These are courtesy of Representative Chip Huggins, and it's 624. 624? No? All right. 619? 619? Okay. Tell Sarah she doesn't have to cook. You bring home the pancakes. Thank you. All right. We've got 3 more sets of tickets to the pancake supper, 668. All right, come on, Miss Judy. Next up is 663. 663. All right. Oh, y'all are a winning couple today. Yeah, there you go, Miss Judy. Okay, and last one we've got is, that's going to go to 635. All right, wonderful. Y'all, thank you for being here today. Dr. Traxler, thank you so much. And Caroline Ward, thank you for sponsoring. We appreciate you.